For families living with sickle cell disease, managing the condition can mean years of hospital visits, medication and caregiving. But advocates say many patients still face another challenge: limited access to specialized care.
Uganda registers between 20 to 30,000 children born with sickle cell disease, and of which 80% of these children die before the age of 5 years. One of our priority areas is to seek government earmarking, funding for sickle cell in areas of diagnostics and care for sickle cell disease.
Government says there has been progress. Uganda is now manufacturing sickle cell testing kits locally, while a local production line for hydroxyurea has also been launched. The Ministry of Health says this could improve availability of the drug and allow treatment to reach lower-level health facilities.
We had already in the past tried to push hydroxyurea to the level of regional referral hospitals, general hospitals, up to Health Center 4. But now we can do better, and as a ministry, we are planning on now taking it further down to the Health Center 3s, because Health Center 3s really speak to the community.
Government says Uganda currently has only 2 facilities with blood exchange transfusion machines.
And of course, the cost for the common person is still a bit high. So I'm very happy that we had members of parliament here, the Minister of State for Youth and Children's Affairs, because as we go into the budgeting cycle, these are some of the issues we need to look at, we need to interrogate.
Advocates say treatment alone will not be enough. They want greater investment in public awareness and screening, particularly in communities where sickle cell disease is more prevalent. They also want screening and counseling to become part of conversations around relationships and marriage.
We also want to encourage the cultural leaders as they marry off their children, as they conduct marriages within their societies. We need to have awareness creation about sickle cell and marriage.
For families already living with the disease, the burden goes beyond the hospital. Advocates say repeated care demands can affect caregivers' employment, marriages, and household incomes.
So many mothers have lost their jobs. So many mothers have lost their marriages, and children are suffering.
The push is now for Parliament to translate these concerns into funding priorities.
We want to see that we leverage on domestic funding more than, donor-funded programs so that we can sustain this.
And while Uganda has made advances in testing, treatment, and even specialized interventions, advocates say the real measure of progress will be whether these services can reach patients before the disease claims another life. Walter Mwesije, NTV.
Thank you.